afternoon, Fishman.
Good afternoon. How are you doing today?
I'm doing well. I am so excited to dive in with you today to talk about the emerging applications for stellate ganglion blocks. So I'll kick it off to you. What exactly is a stellate ganglion block and how does it work?
Stellate ganglion block is a procedure that has a variety of different applications, and we're only beginning to start to understand those applications. When I think about patients who are living with chronic pain, there are lots of different types of pain patterns that people have. Sometimes people have mostly nerve pain. Sometimes people have mostly mechanical pain. And sometimes there's a mixed pain. And in general, it's not just that one pain problem can be, either nerve pain or mechanical pain. It's oftentimes that people have more than one pain generator. And sometimes there's a lot of overlap in how those symptoms end up bothering that person and impacting their daily life. When those symptoms involve a variety of different common features, which, believe it or not, have some commonality across a variety of different conditions. Some of them are pain conditions, but others are traditionally thought of as psychological, psychiatric, or endocrine type conditions. We have to really start to think about how the autonomic nervous system is involved. So, stellate ganglion blocks, which is an injection in your neck that we perform in the office or in the surgery center setting, can be used for a variety of different things where the fight or flight response and the rest and digest response have turned out to be imbalanced. That includes things like PTSD. It includes not being able to taste or smell things after long COVID. It includes chronic fatigue syndrome and a variety of other things, including hot flashes associated with menopause and even heart arrhythmias. And the hypothesis here is that when your fight or flight nervous system gets activated inappropriately, you're inappropriately aroused, reactive, and your body does things that are contextually inappropriate for the situation you're in. Now, when you're in a stressful state, you do have increased fight or flight nerve activity, and that's how our bodies were designed, so that when you were chased by a saber-toothed tiger back in prehistoric days, that you would be able to very quickly increase your heart rate, increase your ability uh, to be aroused. And what I mean by that is to sense things in your environment and ultimately to move away from this threat. In that state, there's a couple of things that happen in your body. You have increased nerve growth factor and norepinephrine, and you feel an increase in anxiety related behaviors. Now, when we block your stellate ganglion, and this image here that you see is a real patient of mine where I've blocked the stellate ganglion, and you see this dark pattern that's our contrast pattern showing our local anesthetic surrounding the structure.
Mhm.
Under that state, we see decreases in these hormone levels that normally would be seen with systemic stress. Now, let's apply that to post-traumatic stress disorder. Now, when people have PTSD, they have a event that they re-experience. And when you re-experience that event, it's not just like you're remembering it. Re-experiencing it is you feel your heart rate go up, your hairs stand on end, you may feel sweating or dryness in your mouth. These types of fight or flight features are experienced again. This is not just watching something on television. This is being completely immersed in an experience.
Mm.
And those sensations that occur are related to the autonomic nervous system and to a reactivating of your fight or flight response.
Got it. What is the autonomic nervous system? Is that different than just your nervous system?
That's correct. So the autonomic nervous system takes place in the background. It's like almost like automatic in that it's always working.
Okay.
And there's two systems. There's the fight or flight system and the rest and digest system. And they're also called the sympathetic system and parasympathetic system. And they exist in a balance in every person. They're both on just to different degrees. But when you get an imbalance in them, it's almost like if you're getting into a bathtub and you accidentally put all the cold water or all the hot water on, it's a very unpleasant bath. And that's how your autonomic nervous system works. It's usually under control of the rest and digest system. That is almost like the cold water is always what's maintaining the perfect temperature. Now, when you jack up the hot water, you may not have enough cold water there to prevent yourself from getting a scalding bath. And
Mm.
that's kind of the way these systems work in your body. When you think about it in terms of what we just described, post-traumatic stress disorder, reliving an event that was traumatic or unpleasant, there's lots of different ways that could happen. It could be the result of a traumatic injury or accident. It could be an interpersonal communication. It could be abuse. It could be a variety of different events that trigger this, and so much so that if you look at the diagnostic criteria, there's hundreds of thousands of combinations of symptoms that would ultimately qualify you for the diagnosis of PTSD. When folks started using this in patients who were in the military, and they looked at 113 active duty military people with PTSD, and they gave them an injection twice on the right side at the stellate ganglion block. And they compared that to doing no injection at that area or sham injection, just placing the needle. And what they found was that their scores on a PTSD score were twice the improvement at 2 month follow-up with the injection as compared to just placing the needle. And so what this tells us is when you combine interaction with the automatic or autonomic nervous system alongside cognitive behavioral or psychotherapy, that you can accelerate those results by helping people reestablish an equilibrium, and that reduces the symptoms of PTSD. When we think about long COVID, a lot of the things that you see in long COVID are really sickness behavior symptoms.
Mhm.
People just look like they're sick all the time, right? And when we see those things, some of them are hard to really understand. Why is it that people have problems with their taste and smell, and also brain fog, and problems with fatigue and energy, and recurrent fevers after a viral illness? And part of that is that there is a imbalance in their autonomic nervous system as a response to this that puts them into this chronic sickness state. So if you lose your smell, half of the people in COVID-19 suffered from losing their smell or having their smell altered. But
Right.
in general, we've found that people actually have smell diseases in 3 to 20% of the population.
Wow.
And
I didn't realize that.
a lot of people have trouble with smelling. And
Mhm.
stellate ganglion blocks have been used before COVID even brought this up as a huge problem. We were using this for people with problems smelling because the sympathetic and parasympathetic nervous system is involved in how we process certain types of senses. And the cranial nerves, which are the nerves that come out of the brain and from the skull, are involved in this as well. When we have lots of inflammation, our body starts to feel sick. And when
Mhm.
that behavior gets turned on, it can be very hard to reset. And so one of the things that people talk about is dysautonomia, and that actually has to do with this particular concept we've just described, an imbalance between the fight or flight and rest and digest nervous systems. The sympathetic and parasympathetic balance is off. And when that imbalance starts to become the new running and operating state of your system, then all of a sudden your network starts to adapt to it. What that means is that you start to behave sick all the time. How do we reset that? We have to reboot your system, and we have to attempt to re-equilibrate your autonomic system so that you can recover from the sickness and state and become well. In a case series of patients suffering from long COVID, a group of researchers started doing stellate ganglion blocks and looking at a variety of different symptoms that we described as part of that sickness kind of um, constellation: fatigue, shortness of breath, cough, chest pain, memory, concentration issues, headaches, muscle pain, irregular or fast heartbeats, loss of smell or taste, depression, anxiety, fevers, dizziness, post-exertional malaise, a variety of different things that make you feel junk. And what they
Right.
looked at is that a lot of patients did not have these before COVID. And that's what you see in blue. Was this
Yeah.
present before COVID?
Right. They're all fairly low.
And then we see in orange the intensity of these after the COVID
That's
viral
crazy.
episode should have resolved. It's not just while you're having COVID. This is after you're no longer sick.
Oh,
And
right. Sorry. So the orange is not while you have COVID. It's
it's after you've
you've
had
already
COVID.
you're done having COVID. You're going on with your daily life, but all of these are still super spiked.
Yep,
That's
this is
interesting.
long COVID.
Okay.
And then what you see is that performing a stellate ganglion block gives you almost immediate control across a variety of these domains. That is, blocking the sympathetic nervous system to the head and face and upper extremity gives you almost immediate control in gray. This just shows you what happens one day after treatment across
Wow.
all of these domains. And
That's
what's most
incredible.
impactful is in yellow that those results are sustained to 2 months post-treatment in this group of patients.
Mhm.
This is huge because, we've done a lot of things to try and prevent the spread of this pandemic and to control active disease. But long COVID has been very, very challenging and has unquantifiable repercussions on patients and their families and work and life around us. When we look at the, um, in general, the problems that we see being treated with stellate ganglion block is they're pretty much quality of life issues, they're function issues. And when we look at the advantage of doing this in patients, it's one simple injection. Now, it is a simple injection in a pretty high value and highly important area of your body. So when
Okay.
we do the stellate ganglion block, we do it in your neck, and people would say, "Wow, I don't have a problem with my neck. Why are you injecting me here?" And that's
Mhm.
just because this is where those nerves lie in their most accessible place. That being said, if you know how to do this carefully, the risks are very low, and we use some of the anatomy to our advantage. Now, the stellate ganglion can be performed or accessed at any of these locations, but we're very comfortable doing this procedure with ultrasound and with X-ray guidance to make sure that I'm avoiding the really important things, are these dark holes, which is where the
Mhm.
nerves come out and go down into your arms,
Okay.
and some of the other really important vascular structures that we saw. But if you do this with appropriate guidance, not only do we know where the tip of our needle is, we also get to use some contrast dye, as I showed you earlier, to ensure that we're really going to be placing this medication around the nerves and not in any of the areas that could cause a patient harm.
Okay.
When we do it with ultrasound, it does highlight for you that there is a lot of stuff in the way to get down here towards the stellate ganglion, which lies right here around my cursor. But again, with a knowledge of the anatomy, there's a safe passage to perform this procedure in almost any patient, any size patient, and any aged patient.
Okay. Is it normally just one injection? Is it different point injections based on like the severity or the type of condition? What is common normally with this type of procedure?
Great question. So, if your symptoms are of long COVID or PTSD, the protocol that we follow is the same protocol that we've been following for PTSD as developed in the military. And that protocol is to perform two stellate ganglion blocks 2 weeks apart. The first
Okay.
block is performed on the right side. And what you see here depicted is actually what it looks like when we inject all that medicine. This is only 5 milliliters, 5 cc's of numbing medicine being injected all around those nerves. And this is an excellent depiction of what a stellate ganglion block looks like in an individual.
Yeah.
If you have any response to a right-sided block, we repeat the right-sided block in 2 weeks. And the reason
Mhm.
is that that's the side of the brain that typically is involved in the type of sickness and wellness behavior that we're trying to modulate.
Okay.
However, not everybody's built the same. And if there's no response to a right-sided block at all, then the second block we would perform is on the left side. And should there be a response to that, we would perform a third block again on the left side 2 weeks later.
Okay, that makes sense. Is the procedure pretty painless, or what would you say from like a 1 to 5 scale, how painful it would be for a patient?
It's uncomfortable to have anybody pinch you with a needle. In this area, what I've found is that pinching you in the neck and then performing the block is very well tolerated. Most of my patients
Mhm.
do this awake without any
Oh,
sedation.
well,
There are
that's nice
some
to
things
hear.
there are some things to know. If we do the block and I do a great job, you will develop something called a Horner syndrome. This is intentional. And that Horner syndrome will last for a number of hours, 8 to 12 hours, while the numbing medicine is blocking some of these nerves. Now,
Is the
but after the stellate ganglion block, you will have some drooping of your eyelid. Your face will feel warm. Occasionally, folks will have a little bit of difficulty temporarily swallowing. So we have some instructions for afterwards. It is not a performance enhancing procedure while you're blocked. But once that numbing medicine wears off, once 8 to 12 hours elapses, and these side effects go away, that's when we start to see the type of improvement in neurologic and other types of symptoms that are really hard to achieve with conventional therapies. But a stellate ganglion block for some of these conditions is really like putting out the fire. But remember, after you put out a fire, there's still work that needs to be done to repair and rehabilitate.
Of course. Well, that's great to know. It sounds like the side effects are pretty minimal for the most part, or at least from a common patient perspective. I'd love to know, how would you compare stellate ganglion blocks to the other pain management options that are out there for these conditions?
With things like PTSD and long COVID, there really aren't other interventions that are being performed aside from transcranial magnetic stimulation.
Oh,
And
wow.
so, what I would say is that this is a new era where these interventions are being applied to a variety of different disease states that happen to involve dysautonomia, and there aren't a whole bunch of alternatives, which
Mhm,
is great. Now, in my practice, that makes me a technician
mhm,
for these types of conditions. And what I've seen is that there's a great deal of safety. I can perform a stellate ganglion block in anybody, essentially, and I can comfortably say that the the benefits that I've seen in patients, especially suffering from long COVID and PTSD, have been significant in terms of their quality of life. This is much more than pain management, actually. This is much more like quality of life restoration.
absolutely. That's exactly what I was going to say. It's just improving your overall well-being. Nobody understands when you have symptoms like this how detrimental it is on your everyday life and how it really affects everything that you do throughout the day. What would be the next steps that you would suggest if somebody is exploring SGB and having these conditions? Can you touch on maybe scheduling an appointment with you?
So there's a lot of different thought processes that people always want to take to treating complex problems that
Mhm,
involve your biology, your psychology, and the world around you and how you interact with it. I know for sure that every individual person presents to us with a unique set of experiences that ultimately bring them to where they're at. That's called their phenotype. How you present is a mix of a variety of different things, and it has to do with stress. It has to do with the environment around you. It has to do with your social support. It has to do with your psychological well-being. It has to do with so many different things that some of which are modifiable, can be changed, and some of them can't be. And so, from my standpoint, and I think this is what's most important, my perspective is one, understanding that everything is experienced individually, and here it says trauma is experienced individually, but what I mean is it's tissue trauma. So it could be a surgery, it could be an accident, it could be an injury, it could be a variety of things. It doesn't have to be a trauma like you think about, like a car accident. And when you experience these things, the way that your system is primed to respond to them is partially programmed, partially learned, and partially influenced by the environment. And then there's a variety of what we call feedback loops. There's opportunities to amplify or suppress different feelings, different sensations, different emotional responses. And when that becomes dysregulated, when that becomes maladaptive, when that becomes, if you want to call it, pathologic, my job is to try and tease out this spider web of problems so that we can separate out things that are biological, right? Is there a trapped or injured nerve or herniated disc? Things that are psychological, that are um, impactful to potentially the recovery from this injury. So things that are social or physical or quality of life or employment related, that are dramatically serving to feed into these feedback loops and promote this sickness state. And when we think about that, my job is like being a quarterback and a ringmaster and a detective and a barber kind of all at once.
I love it. Dr. Fishman, I just want to thank you so much for your time and for just being able to provide even just a high level ideas on stellate ganglion blocks. I hope this answers many people's questions, but if you'd like to learn more, please go to our website, drfishman.com. And if you'd like to, there it is. Awesome. If you'd like to schedule an appointment, you can also go do so on drfishman.com/contact.
Thank you so much for having me. I'm really looking forward to continuing
Thank
this
you.
series, and we hope that this was beneficial to you or to somebody you care about.
Looking forward to chatting with you more.